To conclude this professional development module on XR in medical education, we're going to talk about what the future of XR holds and to look ahead for XR. So specifically, what could the future of XR hold for medical education? So there's three considerations that I want to close this module out with, and I want you to think about. How would future pandemics affect XR usage? As you saw, the devices are often shared devices. Sometimes they're used in group settings. And so it's important to think about, even though these devices can be portable, how can they be managed in an environment where social or physical distancing is required? There is cleaning that has to happen with these devices, especially amongst shared devices. So think about how that model could be used. Currently, there is not really a great remote approach for using XR, whether it's VR or AR, because remote sort of takes away that interaction ability. So relying on remote learning does create a challenge for XR. Now, a potential solution to that first problem is the idea of what if every learner had their own XR device? Now, at the current cost, that is probably not feasible, but thinking 2, 5, 7 years ahead, where XR devices are cheaper or the technology is more ubiquitous on other cheaper devices, it might be feasible to have an environment where every learner has their own XR device. And if that is the case, how could learning change, right? If learners no longer had to come into campus or to a lab to go through an XR scenario, but instead could go through a full simulation at home, how could that be used? Or they could study anatomy in full XR from their home. How does that augment what they do in the actual lab? Some of these XR platforms also allow for collaboration, which if that can be done remotely, with each user having their own device, how does that change the dynamic and the role of XR in those settings? And then finally, I want you to think about what happens if XR included haptic feedback. Now, haptic feedback is actually feeling or feeling touch within the device. And as you saw in the videos, even though the content is immersive, there is no tactile feel that the users have when they interact with the device. There might be a surrogate marker using the controllers that makes it feel like there is a buzz or bump when they touch something using a controller, but there's no true feel for the device. That is changing, however. I know that MedEd as a company is trying to create more haptic feedback. And if any of you have watched movies or read books like Ready Player One, they talk about these haptic suits where people can feel, either through a vest or set of gloves, the environment around them. So how would XR training change if learners could actually place hands on the patient, feel the pulse, palpate the abdomen, do compressions, and feel that resistance feedback when they're doing compressions or performing procedures? So again, the technology is not quite there yet, but think about how XR could be used in those potential settings. So there's a lot of possibility there, a lot of things to consider, but now that you have a strong foundation in XR, it's easy for you to think about what the future could hold. Thanks everyone for your attention and for enjoying this lesson.